Good morning. Good morning. Good morning.
Hi, I'm Dr. Cameron of Derm Scarless Vein Care. I'm very passionate about improving people's quality of life.
It's going to be a great day to fix legs today.
I've been here since 1981. One of the best trips I ever made was to discover Wilmington. And since basically 1985, I've been living in this area. Had the opportunity of meeting my beautiful wife, Tanya, and I have 3 children who have been born and raised in Wilmington. So this is now their home.
Good morning, Dr. Cameron.
Good morning, Karen. How are you?
Good.
Okay.
We have a busy day today. Here's a list of patients for this afternoon.
Thank you.
We have some procedures this morning. I do have an R&D here ready for you. Then we've got injections this afternoon, and we have a few follow-ups as well.
Great. And who's our first patient of the day?
Your first patient of the day is Miss Catherine Barber.
Oh, wonderful. Yes.
She's a young, healthy mother of 2 who is in desperate need of our help.
Oh, my goodness. Yes, I remember her very well.
The first time I saw her, there's this beautiful young lady, only 25 years old. And when I looked at her leg, you could not believe that that leg belonged to that body. The first thought I had, it was going to be some kind of challenge because nobody else had been able to do anything about that.
I think we probably have to do some lasers first and then go ahead and do the injections and whatever else we need to do.
My name's Catherine Barber. I'm a mother of 2 children and I work at a preschool. I am looking forward to get my legs fixed.
My pleasure. Have a great day. Bye-bye. Do you need something?
Ready?
How have you been since your last visit?
I've been doing pretty good.
Good. Still having the pain and the aches?
I
and
am.
everything? How are the compression stockings? Can you tell a difference when you wear them?
I definitely have to wear them, otherwise I'm in a lot of pain.
Yeah.
I have been having heaviness in my legs, cramping, my ankles swell by the end of the day, they're itching, and I have terrible varicose veins.
So I did want to go over your mapping. So all of the red shows the incompetent veins.
Okay, what does that mean?
So normally those valves push the blood back up to your heart, and that's how they circulate. So those aren't working correctly anymore.
The ultrasound allows us to look through the skin to the deeper tissue to see what is which is causing her leg to look the way it is.
When I became pregnant with my first child, I started experiencing varicose veins then and was pregnant again within a year with my daughter, and still my varicose veins got even worse.
The itching makes it very hard to sleep, I would imagine.
Yes.
And the neck cramps are also
I wake up quite a bit with the
good.
cramps.
good. And then having children, you got to take care of them. And then next day work. So I'm sure it makes
It's
really is
exhausting.
affecting your quality
Yes.
of life.
So the plan is to turn things around for Catherine.
My name is James Shankel. I'm a PE and health teacher and athletic director and a coach. I was advised by my doctor to come see Dr. Cameron because I've been having terrible pains in my legs for the last couple of years.
Yes, venous insufficiency affects men almost as much as it affects ladies. James, of course, is a great guy. He is very active as a coach for the local school team. You all know how coaches do. They're very, very active. They've got to run. They've got to push. They've got to keep up with the students. So I get excited. I hate to say this, but because I know it's like giving his legs back, something that he lost 10 years ago or 15 years ago. You can bring him back to the way he used to be.
I've had jumpy legs at night. I've also had problems during the day where I've had cramps in my legs, especially in my calf area. And I've also just had situations during my coaching time where I've just had to take a deep breath and relax because I'm on my feet so many hours per day.
This is where the valve's closed and the blood is supposed to stop right there, but just keeps on coming back.
I've always tried to improve in whatever I do, and whatever we did, make it better. And only when I got to a point where I really and truly felt that I was doing these procedures with zero scar, with no scar, no stitching, I decided to change the name of my practice to Scarless Vein Care.
All right, so what I'm going to do is go ahead and get draped and get ready for this.
I think Dr. Cameron is very dedicated to his job. I think he cares about his patients. So this is the procedure that we're going to do. This is how we're going to do the procedure.
And you should be able to walk today.
Okay.
All right. In fact, we'd like you to walk about an hour.
Okay. That
Okay.
sounds good.
All right. So, any questions for me?
No.
Are you feeling comfortable? You're not feeling anxious or stressed?
fine.
No, good. You're a tough guy, so I don't expect you to be anxious. All right, good. There is not only one tool we use for closure of the vein. We try to be at the cutting edge of the technology. Anything that I use, I make sure that it is FDA approved, that it has been used. I do have this 5-year rule. You like to know that the technology has been around at least for 5 years and patients have done well with it. Okay, fantastic.
Good morning, Dr. Cameron.
Good morning. Good morning, everybody. All right. Good morning, Charlie. How are you? Working with your team is like one brain with lots of different arms. So when we are in the room, everybody pretty much knows what they're supposed to be doing. So it's like an orchestra playing in harmony. This is the NAMI medicine. So this is the NAMI medicine. Very much. Take these, and you want to get a laser, please, sir?
During the procedure, Dr. Cameron and his staff were very, very professional. They kept me inclined to everything that was going on. I had no pain whatsoever.
So now if we could go ahead and get the leg dressed, we'll be all set.
Yes, sir. Thank you
All
so
right.
much.
Thank you so much. That wasn't bad, was it?
No, it was fine, thank you.
It is quite a sophisticated process in that it involves almost every person in this office. The front desk needs to obviously make sure the patient is checked in. Our insurance clerk is involved. The nurse in the room needs to know exactly what position to put the patient in. The ultrasound tech has already looked at the patient's leg. And then, of course, once I do the procedure, then we go ahead and dress the patient and go through the instructions one more time. So when Catherine came back, of course, that was amazing. I could see in her face the excitement and the happiness. It's like you were looking at a different person.
I'm almost speechless because of the difference that it has made. Because I had talked to my doctors, my OB doctor, and they're just like, oh, it's hereditary. You're just going to have to deal with it. You can get compression stockings. But they never, no one referred me to Dr. Cameron. It was my mother-in-law that told me about him.
How are you feeling now that your procedures are done?
I am doing awesome. My legs look great.
Fantastic.
I feel awesome. I'm running and biking regularly. I don't get that tiredness anymore at night.
Great. So you're not getting any more cramps?
No more cramps.
Is the itching gone?
The itching is gone.
Fantastic.
The swelling is gone.
Do you feel your legs are less tired at the end of the day?
Yes, I don't have to elevate them anymore.
Fantastic. You can do that without wearing your stockings?
Yep, I'm done with the stockings.
Fantastic. That's great.
Deep inside, there was, I'm sure, some doubt. Could they help me? Because I think people had told in the past that she probably couldn't be helped.
Looking back at pictures of my legs before I had the lasers done is just unbelievable. And it's just shocking to look at the difference and then to see my legs now.
Let me go and get a quick look with the ultrasound, make sure everything looks great. Everything looks really good here. So basically, it looks both beautiful on the outside and on the inside. So really done wonderful. Since you've had this procedure, do you find yourself more comfortable to show your legs?
Oh,
Like wearing shorts or going on the beach?
definitely.
Or-
I used to not wear shorts during the summer.
And how long were you not doing that?
For years.
Since we've done your procedure, do you feel more confident in showing your legs?
Oh, definitely.
Fantastic.
Definitely.
Good. Well, you've been a wonderful patient. I really mean that. And thank you very much for putting up with us.
I couldn't be happier.
All right.
I've got the best doctor.
Well, thank you. Thank you very much. Appreciate it.
Hey, Derek. I am doing great. How are you today? I'm doing well. Good.
James is back today. I'm very excited to see him. But are his cramps gone? Is the swelling better? Can he run more? Can he run faster? Can he stand more? Can he challenge the students more than he was able to?
Hi, how are
How are
you?
you
So
today?
nice to
Good to
see
see
you.
you.
That's great. So how's things going?
Doing great, doing great.
Fantastic.
Legs are fine, sleeping well at night.
Great.
not having any problems at school when I'm with the students. And I can last longer. Let's say that my
Okay.
legs aren't as tired as they were.
Sure,
And I think the kids
wonderful.
notice it because they're chasing me more around the field and in the ball court now.
Fantastic. And the cramps, as you said, are they gone or they are better?
No, they're gone.
They're totally gone.
Totally
That's
gone. Right.
fantastic.
Yes, I feel a whole lot younger.
Fantastic.
A whole lot younger.
Right.
Probably shouldn't say this in public, but I look forward to challenges and to see the surprise.
There, wow.
Well, it's amazing, isn't it?
That's pretty good.
Look how smooth.
Sometimes when I talk to my colleagues, they tell me, Cameron, don't you get tired of doing the same thing over and over again? It's not the same thing over and over again. Each patient is different. Every challenge is different. Every procedure is different. And you learn from every procedure. So I really feel every case that I do, at least I like to think I'm doing it a bit better than the last case, because that is how human brain is supposed to work. You're supposed to continue to improve. So it is very enjoyable to come to work in the morning.
And I guess it's time to go home. Come on, kids.
No, it never gets boring. It's always exciting. And I can't wait for tomorrow to come back and start another day.